see in the left picture, there was an eye that maybe you can see some swelling in the third eyelid. But when we invert and we open the eye, you can see that we can have a very big lesion that you cannot see if you do not open the eyelids, and you can check the third eyelid. We remove that lesion, and the histopathologic results demonstrates that it was a bronema. Another recommendation, maybe wear masks to avoid the swelling, the rubbing, and the infection. So we talk about meibomian glands. They are important for the formation of the precorneal tear film. They produce lipids, but when we have an obstruction, they start to be swelling. If they are in the border of the eyelid, you can see your own meibomian glands if you avert your eyelid. So when they start to be growing for the swelling, the horse has itch and starts to rub. Sometimes the swelling is too big to form corneal ulceration, like you can see swelling of the meibomian gland and the corneal ulceration there is here. And these are the normal openings in the left picture. The third eyelid, mostly all the animals, the mammals, has a third eyelid. It's useful as protection, and besides has a lacrimal gland. Not as important as in dogs, but it has a production of tear. In all your ophthalmic exams, you have to avert, you have to check it. And we have some diseases that start with some abnormalities of the third eyelid. Like in this case, this is a horse with prekalemic paralysis. So you can see how was this third eyelid everting. It was bilateral. Again. And it was the first clinical sign that the owner noticed. Blepharitis is the inflammation of the eyelids. It's not a common primary cause of eyelid disease in horses. There are different cases of blepharitis. The most common cause is in the horse that the development of a bacterial infection after penetrating trauma. We can find different bacteria. In the picture of the left, that horse was found moraxella. And the picture of the right, it was a very sad case because it was a horse that was attacked by bees. So he was desperate trying to avoid the attack, and we found him with a lot of pain, rubbing, and a lot of stings inside and outside the eye. Now we are going to talk about entropion. Entropion is the inward turning of the eyelid. So the eyelashes are rubbing the cornea, can cause irritation, epiphora, blepharospasm. It's very common to find it in foals that could be congenital or foals that has maladjustment syndrome. So they are with the rotation. And we can see in the picture, in the ventral picture, corneal ulceration that is stained with fluorescein. When we have foals, we can apply temporal sutures to evert the eyelid.